Welcome back. The weather officially started getting colder. That means we are entering cold and flu season. And of course, we've been dealing with COVID as well, RSV in the last few years.
So what do you need to know to protect yourself and your family, of course? So we're joined by ABC Medical Correspondent Dr. Darien Sutton. Thank you for being here.
Good morning.
On a Sunday morning.
Happy to be here.
Thank you.
It's fantastic. We saw a big spike in COVID over the summer. I'm sure a lot of people in their workplaces saw it as well. What are we expecting going into the fall and winter?
So we expect this viral season to go like every other viral season, except we're just up against new offenses. You know, we have COVID, which is the new one, but then we also have things that we know tried and tested and have always existed: RSV, flu, and even whooping cough. Right now, you have to understand that that peak is usually typically between December and February, which is why we prepare now. This is when you get your vaccines updated, you grab your mask, and you make sure that you're doing precautions like cleaning high-touch surfaces.
Who should be wearing a mask? And then I'm going to ask you the next question.
Yeah, personally, everyone should have a mask on them. My personal belief is that when you walk into a crowded room, if you feel the humidity in that room, that's one of the reasons for me when I go, okay, this is my exposure is likely going to increase.
So don't just let your immune system get,
Yeah, don't just let your immune system test it out unless you're okay with getting infected, which unfortunately can be a variable outcome from one person to the next. And it's also important to remember it might be a sneeze or a cough for us, but it could be deadly for someone else.
Somebody else. Okay, I got my COVID and my flu.
Great.
On Monday. I had done the early morning, 2 in the morning. And I got it at the drugstore. And I said, how's this going to go down? She was like, you want to sleep? Because you're just going to be tired. So that's the big thing I would tell people from my symptoms.
That's the most common symptom.
Is that, you tell people get both of them at the same time, don't worry about it. I had the best sleep ever. It was fantastic.
For convenience, you know, when you look at the studies, people go, well, will my infection be worse? Or, excuse me, will my symptoms of the vaccine will be worse after the vaccination? When you look at the studies, the symptoms, the possibility of you getting symptoms is increased, but it's not going to worsen those symptoms after a vaccine. And as you said, it just simply might be more convenient to get both at the same time.
Yeah.
And you mentioned RSV. I have a friend on social media who posted her child is in the hospital with RSV and gave a reminder, hey, watch out. Don't be kissing your kids, even if you want to. You know, you want to give them a kiss and hug them. You don't want to spread anything. Kids are being infected right now by RSV. Can you tell us a little bit about what parents should be looking out for?
Well, RSV stands for respiratory syncytial virus. Now, this is a virus that unfortunately causes very severe symptoms, most often in young infants under the age of 8 months. That's when it's most risky. And in the emergency room, when I'm treating patients with RSV, it can be quite dramatic. The symptoms can be really scary at times. And for that reason, you want to make sure that you mitigate your risk. You know, washing your hands. I don't tell parents not to kiss their children because if your kid is exposed, you're likely exposed, unfortunately. But doing everything else that you can to reduce that risk. For example, for pregnant women between the months of 32 and 36 weeks during their pregnancy, getting that RSV vaccine helps to protect you and your newborn baby if they're born during this viral season.
Yeah, I have a 4-month-old at home, you know, and I take the subway sometimes going home. I touch things. So when I go home, I always make sure I take a full shower before I even touch my kid.
Right.
That's great.
I really do because my wife doesn't play.
I'm sure.
You know, make sure you're safe.
I don't want to see your face. Get in there.
City.
Whooping cough.
Yeah, whooping
People haven't
cough.
been getting vaccinated.
Yeah,
what the heck? My pediatrician makes you sign something that says, I believe in shots. If you don't believe in shots, don't come here.
Well, I understand and respect that. You know, whooping cough is caused by the pertussis bacterial infection, and that it seems subtle, but whooping cough can last for up to 6 weeks long. Can you imagine having a cough that long? It's protected by the Tdap vaccine. That's one of those regular immunizations that's recommended for kids that is effective in preventing it. And as far as whooping cough beyond that, again, the same mitigation efforts that we know that tried to be tested and true. And also, if you have symptoms, wearing a high-quality mask is important regardless of your diagnosis.